This podcast is about storytelling. I am your host, Dr. Mijiza Sanchez-Guzman, Associate Dean of the Office of Medical Student Affairs and the founder of the First Generation Mentorship Program at Stanford Medicine, and I am proud to be first generation. Many of us are the first in our families to accomplish living the dream. Being the first means different things to different people. Join me now on a journey as we share our stories about how we've navigated being first generation in academic medicine. I will have the honor and pleasure of interviewing first generation clinicians, leaders, mentors, students, faculty, and researchers as they share their lived experiences of being the first. I hope these stories will inspire the next generation of leaders in health sciences. Dr. Andrea Fox is a certified physician assistant and clinical assistant professor of medicine for the Stanford University Master of Science Physician Assistant, who joined Stanford Healthcare in 2019 to develop a comprehensive fracture liaison service and bone health clinic championed by Dr. Michael Carter, a trauma orthopedist. Dr. Fox earned her master's degree in medical science, physician assistant studies, and a master's in health administration, both from the University of Missouri. She holds a Doctor of Medicine Science from Southern Illinois University. She has a keen interest in educating primary care providers and the general public on the importance of early monitoring, risk factors, and treatment for bone loss and healing of fractures. Join me in welcoming Dr. Andrea Fox. Thank you so much for joining us. Can you tell us a little bit about your background and what led you to the field of academic medicine?
Yeah, thank you so much for having me. It's a pleasure to be here, and I'm honored to be part of this series. When it comes to talking about the background, of course, it's a little bit of an intimidating conversation when you're talking about, going from your professional practice and what we do in medicine to stepping back and discussing what brought us here. But I do like to share that story, as I started doing just a couple of years ago. Was the first time I ever shared my story. I was born and raised in Ponca City, Oklahoma, which is a town in north central Oklahoma. I was born to two young high school students at 17 and 16 years of age. They did the best they could to raise me, but of course, with the struggles that come along with being so young and not having the support from the family that they needed, I was unfortunately put into foster care systems off and on through my childhood. I had some wonderful foster families. Unfortunately, my parents couldn't hold jobs well. They didn't have an education. They both were into drugs and alcohol, and some jail time was served. And it was a tumultuous childhood, to say the least. Waking up in strangers' homes was not something that was unfamiliar to me or my sisters, unfortunately. I had the opportunity, though, and one of the things that brought some comfort and solace to me was when I was visiting my mother in the hospital. She was in rehab quite a bit as a child, and I would go visit her. And I loved being in the hospitals. I loved the cleanliness of the hospitals. I loved the hustle and bustle. I loved how the providers were running around scurrying, taking care of people. And I especially loved when somebody would maybe look at me as just the child of one of the patients and say, "How are you today?" and make contact with me. I was fascinated by being in a hospital system. And so I always dreamed of being a doctor myself. I went and saw a pediatrician one time when I was young, and she asked me what I wanted to be when I grew up, and I said I wanted to be a doctor. And I can imagine at the time she was probably like, "Yeah, well, that's quite a dream. That's quite a stretch, right?" But she didn't. She said, "Well, you can do, and you can be anything you want to be." And I'll never forget that pediatrician, that female pediatrician that told me that, and gave me that idea that maybe I can do something and be something. So that was my interest in medicine in general. As far as my interest in academic medicine, that was kind of an accident when I went back to school at a later age. I was a non-traditional student. I didn't graduate high school and go straight into college because I had other things that pulled me away. But when I did go back to school in my early 30s, I got a job at the University of Missouri while I was going to school there as well. And it was in the healthcare system, part of the trauma team. So I learned that academic medicine is a great way to not only learn and practice medicine, but to be engaged in research as well as the teaching aspect, which I've always loved teaching. I have 4 young daughters myself, and found that teaching comes naturally to me, and it's something I enjoy doing. So seeing the combination of practicing medicine and teaching, I've found my interest in that regard.
Thank you so much. I remember the first time I heard your story, I was just blown away by your vulnerability and candor, but your ability to inspire an audience. And that's one of the many reasons why I feel connected to you, and I think our students are so connected to you as well. Can you tell me a story? When did you first become aware of your first gen identity?
So the first gen identity was not a term that I used regularly or that I had identified about myself. What I did start realizing is probably around third or fourth grade, I started realizing that my home life was not like those around me. That's when girls unfortunately start becoming kind of mean and picking on people and saying, well, why do you come, ride in a different car to get to school every day? Or why are you wearing the same clothes you wore yesterday? And, would I started realizing, well, everyone else goes home to the same house. Their mom and dad are involved with their sports and their activities. And my parents weren't there much throughout. And they didn't come to my basketball games, believe it or not, at 5 foot nothing. I tried to play basketball. I didn't have that family support that I recognized other people did. It was when I suppose I spent time with a couple of the foster families that I spent more time with. There were some foster families that I had more time with, and they had older children who graduated high school and were going off to college. And I remember going with them. I was probably 9 or 10 years old, and my foster sister was going off to Oklahoma State University, and I got to go with her to see the dorm she was moving into, and I kind of went with them to help set it up. And I was like, wow, what is college? We didn't talk about education and college at home. So that was my first exposure. My parents didn't talk to me about it. They didn't finish high school. They didn't know what they didn't know. And so I don't fault them. I don't hold grudges, or I'm not upset about it, but I didn't realize I was a first gen until that term was brought up, maybe later in life even. I still have a hard time recognizing that because I don't identify myself as I'm a first gener. I'm a first, like, look at what I've done. I don't see myself in that way. I just have done what I felt like I needed to do to get away from that background. I knew I didn't want my children and my life to be the way it was as a child.
Mhm.
So I recognize myself as a first gen, if that makes sense.
It does. It does. What are some of the barriers or challenges you faced as you pursued your career in medicine?
That's an easy answer. So I'm hearing impaired. I have hearing aids in both ears. I started losing my hearing. I think the first time I was tested was in fourth grade, where you do the little beep test where you raise your hand. And in fourth grade, we'd been doing that test every year. And in fourth grade, I remember the person testing me saying, raise your hand when you hear the beep. And I said, okay, I understand the assignment here. And I guess I wasn't raising my hand. And they were like, you need to be doing this. And I was a very compliant, very good student. I wasn't being rebellious. I just didn't hear it. And so that's when it was recognized that I had had a hearing loss. And I had had some significant fevers the year before and didn't have medical care that I needed, I'm certain. And they think that could have been, really high fevers and some hallucinations and such that could have caused some damage to my hearing. So going through life and then going back to school in my 30s, being hearing impaired and being in a huge auditorium full of other students, and I didn't have the hearing devices that I needed. I didn't have the support that I needed. I was too embarrassed to let anybody know that I had a disability. I never told anyone I had a hearing impairment. All through my college years, all the way through my doctorate, no one knew. And so I tried to sneak. And so one thing I learned was that when you're hearing impaired, not only do you have to hear what's coming in, but you have to process it and take that extra amount of time to process it. Then process what you're actually hearing. And then to process the information as well, it takes that double time. So I felt like I wasn't as responsive and quick as I could have been while I was in school because it took me twice as long to hear it, process what I heard, then process that information as well. So That was definitely a huge barrier, but I got through it. I made it through, made it work, did recordings on my own and so forth. And then certainly I didn't have the financial support. I now know, had I told someone about my hearing disabilities, I may have had a scholarship to help pay for some of my schooling. I'm stuck with student loan debts now that I wish somehow I could have had hearing, some scholarships or something for hearing impaired, but I was too shy and didn't know what I didn't know. I didn't have the resources to help me navigate my way and my path to get into college. I wasn't looked at as a student that had an opportunity, especially in a small town in Oklahoma. We didn't have people standing around to say, you know what, you do really well in school. I've always done well in school academically. I didn't have anybody to say, hey, come with me. I'm gonna guide you. I'm gonna show you how to make this happen, or even somebody that believed in me to make that happen.
Yeah, thank you for sharing. I'm also hearing impaired, and I remember always watching things with closed captions, and people were like, "Why are you watching with closed captions?" I couldn't
I
hear.
didn't know this. Yeah.
What do you wish you knew before entering the world of academic medicine as a first generation professional?
I wish that I knew what I was actually capable of before I started the endeavor. When I went back to school, I didn't have goals of going to medicine. I wanted to practice some sort of medicine. And I always wanted to be an MD or a PA. I learned what PA was later. And I thought that's a fantastic opportunity to practice medicine. But I went in saying, I just want my undergraduate degree. That's what I want. I want to prove to myself that I am capable of just getting a bachelor's degree. And so I set forth trying to prove to myself and anyone around me that may have been naysayers, which I did have those in my life as well, given the background that I came from. I didn't have that ability to tell myself, like, I am capable of this. I can do this. And so I wish I would have known that earlier on. I might have made my path to practicing medicine a little easier had I believed in myself. And so
Hmm.
it wasn't until I got my bachelor's degree, and then I said, well, that wasn't as difficult as it was. It was definitely difficult because of I had children, I had, another life. I had to work. I had to do all these things along with it. But had I known even at a younger age, maybe I could have started sooner and made that happen. And then I was like, well, I did my bachelor's. Maybe I can get a master's. Let's see if I'm capable of that. And then I was capable. And then I got another master's, and I became, and then now I just finished my doctorate. I was like, wow, why didn't I ever believe in myself? Right? I put limits on myself, and nobody else put limitations on me. Of course, there's always the financial limitations and work around to deal with finances. But as far as making things happen, I wish I would have known that I am capable, and we are capable of whatever it is that we want to do. We can't tell ourselves otherwise. So I think that's just that capability.
Hmm. It makes me think of that quote. Oprah Winfrey says, "You are not your circumstances, you are your possibilities."
Yes, it's such a true statement.
What advice would you give to someone interested in pursuing a career in academic medicine?
I think to realize that the sky's the limit. One thing I love about academic medicine is that if you want to pursue something, you can. And within even my niche area of medicine, I practice bone health. There's not a lot of people that practice bone health. I see patients who've had broken bones that aren't healing and they need my assistance. Like, why aren't I healing? Is there something metabolically going wrong? Or why am I fracturing so much? We don't have a lot of providers that practice this. So it's very niche medicine. And I do love this practice of medicine. And niche is kind of fun because everybody comes to me saying, what do I do with this patient? And so I have answers. I try to find them anyway, if I don't. But to realize that the sky's the limit. I'm doing national conferences. I'm teaching. I never thought I would be a teacher, a professor, clinical assistant professor at Stanford. Are you kidding me? I came from Ponca City, Oklahoma. And you open your own doors. You have to keep the doors open. I always tell my own children and any students that I teach, doors are going to be everywhere. Put your foot in it, kind of peek in a little bit. Don't let it close all the way. Always kind of have several doors open that you can kind of peek in and out of and see what are my interests and do any of those interests relate to me at this time? Is this the time for me to walk through that door and explore? something new within the area of practice that you're in. So I think that, again, not limiting ourselves, and we are all alike. That's the other thing. There's our circumstances, to go back to what you just said, don't make who we are. Sometimes our circumstances can actually help us become better at whatever it is that we're in practice, if it's medical practice or whatever job or role that we have. Sometimes the circumstances that led us here, in my example, I'm a compassionate provider. I definitely know that. And I hear that from my patients. I can talk to patients who are, without homes. I could talk to patients who have the biggest mansions of homes. It doesn't matter your socioeconomic status. It doesn't matter where they came from, what walk of life they came from. I try to love and care for each of my patients equally, because guess what? Their hearts all beat the same, right? Their blood flows the same way. Their bones break the same way. So I think that our circumstances can make us, not change us.
How has being first generation shaped how you approached your training and professional career?
I think that it has really driven me to continue to pursue more. It can sometimes, not to look at a negative aspect of it, but it can become a driving force and focus in life more than I maybe want it to be. So I have to kind of reel that back sometimes and remember that what is important in life are the people that are around us and the people that we touch, rather than, what is it that you do for a living? What is it what's your education level? Because it can go from swinging one way to the far other extreme. And so trying to find that balance has been super important for me. I think it does drive me, though, to continue to excel and to continue to find even more doors. It's exciting. It's exciting to continue to find more doors that we can open and peek into, to see what opportunities lie ahead and who we can impact along the way. Being connected to my students has helped me realize that my words that I can offer them, or my experiences that I've had, even in my climb to becoming a provider that I am now, really does impact them. And they want mentors that can share with them and help them learn and help guide them too. So even though they might have come from different backgrounds, that hasn't changed my ability to mentor them. In fact, I think it's allowed me to be a better mentor.
I agree, 100%. Do you believe your first generation status influenced your career choices and trajectory? And if so, what ways?
I don't think it's influenced my choices. Actually, I want to take that back. I do think it has influenced my choices. I remember, as I mentioned, being a young girl and not getting the medical care I needed. And I also remember many times my mother was a drug addict. We would go, she was an opioid addict. So it was, we'd go to the doctor a lot. Somebody always had a problem. I remember she got pills sometimes under our names so that she could have pain medications. I clearly remember that. I remember providers and doctors treating her very poorly. They knew, and I was probably in my late single digits into my 10, 11 years old when I started realizing that these doctors know my mom is seeking. She's a drug seeker. And they would treat her poorly, and they would treat me poorly and my sisters poorly. And I felt that. And I always knew that if I go into medicine, which I dream of doing someday, I will never treat somebody like that, even if they are seeking. These are the mothers and fathers and sisters, sons, daughters of someone who has no power over that disease of addiction. So recognizing that, I think, has helped me in my practice. I don't think I answered your question in that round, but so yes, I guess it has influenced overall my practice and my being first gen. Though it hasn't really influenced the decision to go into medicine. I don't, except my background did. Does that make sense?
Makes perfect sense. How do you believe we can make the field of academic medicine more inclusive and accessible to first generation professionals and trainees?
These sorts of conversations are a fantastic start, if not a long goal approach to making that happen. I think that we have done overall, and I'm speaking on behalf of, where I grew up, where I went to school, I didn't have somebody saying, you can do this. Look at these resources. Andrea, look at your scores on your test exams. What do you want to do someday? And how can we help get you there? And just because your parents didn't go to college and don't talk to you about going and visiting colleges your senior year of high school doesn't mean that you can't do it. I think we have to have these conversations. We have to identify and show people who are first geners that, look, if I can do this, anyone can do this. And so we've got to keep telling the stories. I think this is a fantastic first approach to that.
Thank you. Can you share any mentors or relationships that have been particularly influential in your career?
One of my foster mothers, she's still living. She's older now and she doesn't remember names much, but Judy Hoyle, she was one of the most amazing foster mothers. And I was with her and her family the most whenever my mom would go to rehab or wherever the situation was. And she always believed in me. She was always there for me. It wasn't that she told me you could be president one day. It was none of that. It was the example of having a solid foundation in a home and being shown love. And she loved me and she was always there for me. And she was also the one that had the daughter that went to college. That was an example of, wow, I want to do that someday. Even though I didn't do that the traditional way, I had that example. And also, as I mentioned earlier, that pediatrician that talked to me as a provider, as any of you that are providers listening, talk to the children in the room. We don't know the impact that one conversation the pediatrician made on me saying, what do you want to be someday? And I was so fascinated with the surroundings that I said, I want to do this. I want to be in these kinds of rooms. I want to be in a clinic or being in the hospital, seeing the nurses running around, any of that. So we've got to remember that our presence and the words that we use in the setting of young children are extremely impressionable, and we can continue to influence their decisions to be providers someday too.
Mm-hmm. Mm-hmm. How do you celebrate or honor being first gen?
I don't know that I guess I celebrate being first gen. I think I would say that more than celebrate it, I want to encourage others more. So I want to give back and encourage young girls to, or young women, young men, anyone that has backgrounds, similar to mine, that you can do this too. It you don't have to come from a lot of money or parents who are CEOs or doctors. You don't have to have family members that are doing this to make it on your own. If you have a goal and you have a passion in life and you have a drive, there is somebody out there. Keep seeking, find someone that will listen to you and help you achieve those goals. Keep your eye on the prize and always have goals before you and hit those goals. And I like to tell my kids, a goal can be really intimidating, right? And everyone, a lot of times, I'm a word picture person and I'm a visual, even in my own pursuit of anything in life. And sometimes we have this goal, like, I'm going to finish college and there's this mountain ahead of us. And you see all this coursework and all these units and hours that you've got to collect to get there. And rather than looking at it like this really steep mountain, that looks absolutely impossible. I cannot do that with all the life stuff I have going on. Rather than being that way, I tell my kids, look at it like, oh, I just broke it down and it's this little rock. See that little rock? I've got to climb over that one little rock right now. Can I do that? Take little bite-sized rocks and climb over that rock, climb over that rock. And before you know it, you're going to look back and you're like, oh my gosh, look how far up I am and look how far I've come. And it's not so painful, right? So just breaking it down into little pieces and doing that in everything in life. Losing weight, for example, you don't go, oh, I need to lose 40 pounds. And then you just wake up and lose 40 pounds. You got to, like, hey, a pound, a pound. So I guess when it comes to celebration, we celebrate each little win, each little positive impact. When a student responds to me and says, Dr. Fox, I cannot thank you enough for that call that you took, because your words helped calm me down when I was nervous about failing a test. Or not doing so well as I wished I would have done on this or that. And I say, you know what? We all fail. We're not perfect at everything. We're going to get back up and we're going to work through it and we're going to do it together. That's how I would guess I celebrate. We just, all these little wins. Those are the rocks that I celebrate now.
I love that. The small wins. Is there anything
Yeah.
else you'd like to share with our viewers?
I guess it's just that it's an honor to be here. I don't have anything profound to say. I honestly, it's been a dream and a blessing to be part of Stanford Medicine, to be a practitioner at Stanford, to be a practitioner in general. We have so many opportunities in academic medicine that, again, you have dreams and goals, pursue them. You can make you can find areas of medicine that you can be an expert in as well, if that's your goal, or you can see as many patients as you'd like. There's enough patients to go around. And we need innovation and we need passion and we need caring providers, most first and foremost, caring providers who really aim to be, I hate to use the word blessing again, but like to really make an impact and change the lives of patients, and not just medically, but the heart. And I love that side of medicine, is the heart of medicine and the heart of the patients and the people that are in front of us. Being real and authentic with our patients is what I really try to teach our students more than anything else. Is when patients know that we're real people too, and that we have a real caring soul and that we are here for the right reasons, they will respond, and their outcomes, there's plenty of studies that show their outcomes are better when we believe in them and we show them that we truly do care. So I think that's my end note.
Well, before we end, I do have some rapid fire questions. Can we ask you some
Oh,
rapid fire questions?
on the spot, why not?
Okay. Speaking of real people and getting to know you, what are you currently reading?
I just read oh my gosh, I have it sitting here. It was a mystery. Oh, and I forgot the name of it. The house on the lake, the house across the
Oh,
lake. It was just something I picked up at the airport. But I do like to have something that I'm reading, and it's just a mystery novel. I do like mysteries. My alter ego would be like a detective. I like to like investigate things. And I guess that's why in my practice I like to look at labs. We could tell a lot with blood work, right? And so yeah, it's just a murder mystery.
okay. What's the last good movie you watched?
I do not remember the last movie I watched, but I did watch a Netflix series, just easy TV, about the Dallas Cowboy cheerleaders. And I watched that because two of my two girls that are in that show actually were dancers with my daughter, and so that was the last TV series that I watched.
Are you a coffee or a tea person?
Coffee person. I don't like any cream or sugar in my coffee though. I like to drink it just straightforward.
Good to know. If you could live anywhere in the world, where would you live?
That is a question I'm currently trying to answer. I don't know. I tell you, I love the Carolinas. Have you been to Charleston, South Carolina? That is a beautiful, charming
Yeah.
place. The first time I visited Charleston, I got off the plane and I was like, wait a minute, I've been here before. I felt like I had lived another life in Charleston, like maybe I was some Southern belle. And I went to some of those homes and I felt like I belonged there. It was the most odd thing, but I love Charleston. It's so beautiful. I don't know that I want to live there full time. It's quite hot and the bugs are big, but I hadn't thought about that question.
What podcast, if any, are you listening to right now?
I have found, going back to the detective murder mystery stuff, I have found this new guy, Mr. Bammer, Mr. I don't even know his name, but I just started following him the other day. And while I'm driving, I'll just maybe listen to a little mystery that he reads. He's a very good storyteller. So he's a storyteller and he just recants stories about mysteries. So definitely not on the medical side of things, but again, like I said, it's kind of my alter ego, loving the mysteries and so forth.
I have a good one for you. Are you a morning person or a night owl?
Definitely a morning person. My brain is on full charge. I can get up at 5 in the morning and just go and I knock it all out. I love getting up early. Sometimes it's difficult, but I love to knock everything out in the morning. But you hit me at 4 o'clock, 4 p.m., dead hour for me. I can't think for a second. And then I get another wind around 6 p.m. or so. But after 9, I'm no good. Between 4 and 5, don't talk to me. It's
Going back to the podcast question, if you've not listened to Criminal, I highly recommend it if you like mysteries.
okay. I have not, so I'll definitely check that out. Thank you.
Mm-hmm. What's a song that always makes you happy when you hear it?
Hmm. These are the hardest questions because it's like, oh, rapid fire. Let's see. Uh, it's a Joss Stone song, and it's kind of almost amazing to, um, don't tell me that I can't, I can. Don't tell me that I won't, I will. How does that song go? I forgot the name of it. But I used to play that for my kids, like when I'd wake them up in the morning. Now I'm not even remembering the name of it. So it's a very high energy. And it's like, I'll tell you what I can do and what I can't do. Watch me. Yeah.
I'll find it.
Okay.
And the
You'll know.
last, I'll find it. Yeah, I love Joss Stone. What is the best piece of advice you've ever received?
I would have to say it was a piece of advice from my grandfather. He
Mm,
says, live every day. I know it sounds cliche, but live every day to the fullest. You don't know what tomorrow brings. You don't know. And I've got a picture frame over there with him lying in a hammock. And he says, enjoy each day because you don't know if you'll have tomorrow. And
mm,
I think that's something that I try to remember to live in the moment. It's real easy when we're goal setters, when we're type A personalities, we have all these big things that we're after and we're trying to achieve. It's real easy to forget to be in the present moment and to identify what's around you and to try to find the happiness within that. But I'm trying to be better at that. So that's really good advice.
hmm. It is. Andrea, thank you so much. This has been an honor and a pleasure, and I really enjoyed speaking with you this afternoon.
I appreciate you inviting me. It's quite an honor to be here as well.